Welcome to Living Pain-Free with Frank Titus of Titus Motion Therapy. Whether it's you or someone you love suffering from chronic pain, we want you to know there is hope. Titus Motion Therapy offers an 8-week therapeutic exercise program based on 24 years of experience in exercise therapy and pain elimination. We have a 95% success rate treating our patients. So whatever ailment you or your loved ones are struggling with, we can help. Our topic today is opiate overuse, America's self-imposed epidemic. America has a serious problem with opiate overuse. The opioid class of drugs includes not only illegal drugs like heroin, but it includes legal prescription pain relievers that we're all familiar with, like oxycodone, hydrocodone, codeine, morphine, fentanyl, and others. These drugs are prescribed by doctors because they relieve pain. But the American Society of Addiction Medicine is now reporting that of the 21.5 million Americans 12 years or older that had a substance use disorder in 2014, 1.9 million had a disorder involving prescription pain relievers. Drug overdose is the leading cause of accidental death in the U.S., with 47,055 lethal drug overdoses in 2014. Opioid addiction is driving this epidemic, with 18,893 overdose deaths related to prescription painkillers in 2014 alone. So many families are being affected by this epidemic. Frank, we would love for you to weigh in on this problem. What do you believe is causing the opiate overuse problem in the United States?
I think there's many ways to answer that question. First of all, something like 80% of people have back problems, and that's worldwide. So I think from that standpoint, we sit too much. We're designed to be hunters and gatherers, of moving around, climbing trees, picking fruit, gardening, all of those things, chasing animals. So that can lead to a lot of problems. Weak core, weak structure, poor posture, dysfunctional gait pattern, and it's medication for all of these things. And with every medication, there's certain side effects. So you might take one drug for something, next thing you know, you're taking 2 or 3 others for those 2 or 3 side effects. All of those things dehydrate you. That creates inflammation in the body, can make the pain worse in the long run. The other thing is people want a quick fix. People don't do things for long term. They should probably give you pain medication for like a week, and they usually give you a month. And so what happens if you feel better in a week? Well, you put those up in the shelf, and next time something a little, maybe just something a little hurts, then you start taking that. Next thing you know, you're addicted. And it's a big problem. Even in the news, it was in there about how much overuse and kids are getting addicted, and it's a big serious problem.
So doctors are actually contributing to the problem by overprescribing. How does the work you do at Titus Motion Therapy help with this problem?
The first thing is we alleviate pain. That's the number one thing people want to come in to see us for. And within an hour, typically the first hour, the first time I see you, you're going to have pain relief. Now it might last 5 minutes, it might last 5 hours, it might last 5 days. We don't know, especially because you're going to get in your car and it's going to shorten everything up. So I usually tell people that have really serious, excruciating pain that it's going to probably come back as soon as you get out of that car. You probably have to go home and redo them right away. We have over 95% success rate. Back surgery has 50%. Neck surgery has 30%. And I just read an article where something like 1/3 of every surgery is done incorrectly. So that's why they have you autograph which knee you're supposed to operate on, which is kind of silly to me because when I tell the mechanic I have a brake that needs to be fixed, he didn't make me autograph the wheel that it's on. So they need to slow down and pay attention. Everybody needs to take responsibility for their own health, that's for sure. It's not just the doctor's fault, but we need to take care of our own health. And that's something that we do too. I put the responsibility onto the patient. I tell people I'm kind of like Home Depot. I'm going to sell you a hammer. You have to go home and do all the work. And it's only going to take about 20 minutes a day. The other thing is by alleviating the pain, then you're not going to need the drugs. And this is a long-term thing. It's not pain management. Pain management, to me, again, is a little silly because you're managing your pain. Well, you could manage it with drugs. What we try to focus on is alleviating the pain. When you're tired of getting worked on and ready to get well, come and see us.
So you can keep clients from becoming dependent on the drugs. What about someone who's recovering from overuse?
Well, that's a great question too, because I've worked with people in rehab facilities, and I do more than 50% of my work on Skype. I can throw an iPad into a rehab facility. I can work on people there without even being there. We don't use any equipment whatsoever, so it's easy to implement wherever you are. I can treat you from anywhere. I can treat you to anywhere, wherever you are. What it helps too is the responsibility effect too. I'm making you take responsibility rather than you being addicted to this drug. So if you take responsibility and you're taking care of yourself every single day and you're out of pain, you're not going to need this opiate or whatever painkiller, then guess what? Rehab's going to be a lot easier as well.
Wow, that could be an important component to full recovery. Now, what about people who are in really excruciating pain or that they can't leave their house? Maybe they're bedridden. Can you still help them?
Absolutely. I've worked actually on a guy who was in a hospital bed trying to get surgery on his brain, been in an accident, and he was in such excruciating pain that they kept having to give him pain medication. Well, when you're on pain medication, they couldn't do brain surgery. So I came in and actually worked on him in the hospital bed, he alleviated his pain so that he could get brain surgery. Not everybody's that bad off, and I can see you wherever you are. So if you're bedridden, you can have your neighbor, if you can't do it, flop up a laptop, and I can show you what to do right in your bed with a couple pillows, basically, and start to alleviate the pain and get you on the right track.
Wow, that's amazing. What would you say to someone who's listening to this and they've become dependent on opiates? They're using them every day. They're thinking this could be an option. What would you say to them?
I would say, first of all, don't lose your hope. Many people come in and they've seen people for years and years and years and been told nothing can help, or it's in their head, or you're going to have surgery, or you're going to take medication. And that's the number one thing that people tell me is, thank goodness for you, because you gave me back hope. And most people don't want to do something big like run a marathon or anything like that. The number one thing is people want to play with their kids. And so I would say don't lose your hope that there is a way out of this, but you're going to have to take some of the responsibility and do a little work in order to get out of it. But we only see people once a week for 8 weeks. So it's a really short period of time rather than laying in bed and taking opiates for 2 months. After 2 months, just think, wow, I could have been up walking around.
There's a path to getting well.
Yes, ma'am.
Thank you so much. Thank you for listening to Living Pain Free with Frank Titus of Titus Motion Therapy. You can find useful resources, ask a question, or book an appointment anytime from the website at titusmotiontherapy.com. We also hope that you'll connect with us on Facebook and Twitter so we can continue this conversation on health. We want to help you in your quest to live pain-free.